let's look at questions that came in this year INICET, and there were lots of huge number of pathology questions there. Let me just have a look at few questions what I got as a recollection. Okay, yes, so let me start. And there were lots of genetic questions in INICET, which sometimes is expected, sometimes is not. Most important thing is there are many hi-fi questions which are not expected at the level of undergraduate, and in that case you better would have left those questions rather than getting negative marking, I guess. Let us see. So first question was a simple one. Differential expression of parental genetic material in a child is known as. So we studied this in the class. This is your imprinting. So we understood in both Prader-Willi-Angelman syndrome there will be a paternal gene and a maternal gene. Sometimes only one will get expressed, like in Prader-Willi gene only the paternal gets expressed, sometimes only the maternal will get expressed. That is what is a genomic imprinting. That is the correct answer. It is not reduced penetrance. Reduced penetrance is when the disease is not happening despite there is a mutation. That is called as a reduced penetrance, right? Then incomplete penetrance is also the same thing. Mosaic is more than one genotype in the same person. More than one genotype in the same person. The second question, where I expect many of you have answered it wrong here, and not expected out of you. It is more of a very genetic molecular microbiology question. Most common banding technique, or I don't know what was the technique, most common word was used or not, it doesn't matter. Banding technique used to identify this word, if it was mentioned, dicentric chromosome, was this mentioned or not? So I'm sure if this was not mentioned, question was very simple question. So most common banding technique used will be G banding, everybody knows. But if it was a dicentric that was mentioned, what do I mean by dicentric? In dicentric, there will be, this is your normal chromosome. Let me draw one normal chromosome here. This is your centromere and this is your chromosome that appears, right? So normally your centromeres will be less stained. In G banding, hypostained areas or unstained areas, centromeres. Whereas a dicentric means there will be two centromeres, and it is very difficult to identify a dicentric. This is C1 centromere 1, this is C2 centromere 2. So it is very difficult to identify on routine banding. Why? Because in routine banding, alternatively you will have less stained and more stained areas. So for that we use C banding. C stands for Centromeric Banding. If you, yes, G for GIMSA is the special stain, Centromeric Banding. Centromeric Banding is ulta staining. That is, centromeres will stain dark here. Centromeres will stain dark and the rest of the chromatin will appear pale. Let me just show you one image of C banding. This is your C banding technique. Look at this. This is your centromere that I am seeing, which is dark in color. So if it is a dicentric, how does it appear? Dicentric means one chromocentromere and another centromere like this. This will be the dicentric one, and answer is C banding. Remember C banding, the staining will be and one more is R banding. What is R? R is reverse of G banding. Reverse of G banding. And one more is Q banding. Q banding is used to identify Y chromosome if they ask this question. So for Y chromosome identification and understanding we use Q banding specifically for Y chromosome. So this is about the center. So very important keyword becomes your dicentric. If dicentric was given, then the answer definitely is C banding is the correct answer here. Next, one more. I got various responses for this question. Identify the test that is given in the image. That is only I have given you. I think there was some clinical history also given, and they had asked if there is a translocation in this. And of course, what is the investigation here? This is your fish that is there, and look at this. There are two different colors that I am seeing here. So this will be probe 1, I can use the word P1, probe 1, and this will be P2, probe 2, red and green are there. And wherever both of them have fused together, this is your translocation. Translocation that I am seeing. So wherever they have fused, this is your translocation. This part is your translocation. This is your translocation. So this is your translocation that is seen in the image. So I don't know whether it was translocation that was given or just identifying the investigation. And investigation here is the fish that is there. So answer is option D, fish. Which of the following is X-linked dominant disease? And this has been detailed in pediatrics. They have discussed all these diseases. Rett syndrome is the answer here, right? We'll not get into detail of it. True about genetic screening. So this question, little bit of options, confusing option. True about genetic screening are all except has been asked. So screening involves invasive method. This is a true statement because genetic screening, especially in intrauterine life, involves chorionic villus sampling or amniocentesis, which are invasive technique. Option B, this I think what I have got, this is exactly I have written it, but I think what examiner meant in this was it is more reliable. So I'll rechange the words, more reliable. I'm using this, more reliable for screening than diagnostic purpose. If this was the statement, then it's a false statement. It is more reliable for screening than diagnostic. No, genetics are diagnostic. They are more reliable for screening or of course they are reliable for screening, nothing wrong with that, but we don't use for screening. That's a different thing. Screening is done commonly with many other blood investigations which are less invasive. Tells about, so this is tell about genetic risk of transmission. This is a true statement. Now, screening involves genetic mapping. Of course, sometimes it involves genetic mapping. This is a true statement. That's why I am now worried about what was the option B. If screening is it is more reliable for screening than diagnostic, then definitely that is the false, and that is the correct answer here because question was all except. Next, partial aneuploidy is seen in WAGR syndromes, congenital adrenal hyperplasia, testicular feminization, Cry-Du-Chat syndrome. Cry-Du-Chat syndrome is your partial monosomy of chromosome 5. Right? Yes. Small arm of the chromosome 5 is deleted there. That is what is Cry-Du-Chat. Micro deletion of IP. Okay. Cry-Du-Chat syndrome. Next question was technique used to assess low allele frequency is. So, for low allele frequency, less likely to use PCR, remember, and fish, because the allele itself is very, very low in your, the population, then you cannot have a probe against it. Probe is in the sense, the complementary strand against it. So, better would be a genomic sequencing, if that is the, that was the given option here. Answer will be genomic sequencing here. Singer's sequencing. Which of the following is correct ratio of T cell to B cell in the blood? T cell to B cell, T cells are around 60 to 70% are T cell and around 30% are B cell. So which makes it approximately 3:1. That will be the correct answer, not 4:1. It is not 75-25. Even if 75-25 is 3:1. 80-20 will be 4:1. That is not the case. So answer is 3:1. Next, MHC class 1 bind to antigen and activate what? CD8 cell. We already knew that MHC into, we had remembered this, MHC into CD number is equal to 8. Class 1 into 8 is equal to 8. Class 2 into 4 is equal to 8. So this is your CD8 cell is MHC class 1 restricted. True about next question, autophagy is. So they had asked this question, autophagy. We had discussed this in the class. Happens if there is excess protein in the cell, false statement. It will happen if there is a deficiency of protein or deficiency of a nutrient to the cell. That is true about your autophagy, isn't it? Next, autophagosome binds with phagosome to form an autophagolysosome. This is a true statement. Why? Because there has to be an autophagolysosome formation which will ultimately break down your the organelles and use it for energy generation. Autophagosome is a single membrane bound organelle. False statement. It is a double membrane actually. So binds with any organelle will be false. It has to bind with autophagosome only. Which of the following is not a part of innate immunity? Options were variable, what I have recalled, B cells. Basically, B cells, CD4, CD8 are not a part of innate immunity. They are part of adaptive immunity. Gamma delta T cells are in GIT, part of innate immunity cell, complement part of innate immunity, defense sense part of neutrophil, part of innate immunity, skin epithelial barrier, part of innate immunity, secretions are also part of innate immunity. Body secretions are part of innate immunity, and enzymes in the body secretions like lysozyme are also part of innate immunity. Next question, this was a match the following, and I'm sure you would have got the correct answer by knowing the other things. Probably there was one new for many of you guys, but if you had attended the systemic class, then you would have answered this correctly. So neuroblastoma, NMYC. So this is option 2, NMYC will be there in neuroblastoma mutation. Retinoblastoma, RB mutation, that is so this will be your option B, that is RB. Burkitt lymphoma, CMYC mutation, so this is 3. And pleomorphic adenoma, that is your PLAG mutation. PLAG mutation. So what is PLAG? Is pleomorphic adenoma gene. Pleomorphic adenoma gene 1, basically. Pleomorphic adenoma gene 1 mutation, PLAG. So that is the answer here. One more question on pleomorphic adenoma, and I've seen this being answered wrongly also sometimes. Which of the following is not a feature of pleomorphic adenoma? So question asked specifically which is not, and answer is perineural invasion. Perineural invasion is a feature of adenoid cystic carcinoma. Very classically, adenoid cystic carcinoma. We discussed this in parotid gland and salivary glands. Adenoid cystic carcinoma, even it can be seen in basically invasion of nerves will be seen in malignant, can be seen in mucoepidermoid, but classically in adenoid cystic carcinoma. Squamous epithelium can be seen, correct. So there will be epithelial element seen, either there can be gland seen or there can be squamous epithelium seen. Chondromyxoid stroma is true, it will always be there. Myoepithelial cells will also be present. So answer to this question is perineural invasion. Now, next question, cell-in-cell appearance is seen in. I'm sure all of you have ruled out and answered this. Not seen in necrosis for sure, not seen in apoptosis also, not seen in necrotosis also. So only one is left, is entosis. Now, what is entosis? So there are two things that will confuse you, entosis and emperipolesis. Emperipolesis. Entosis is, one cell attaching to another cell and internalizing that cell. So what happens is entosis is due to defective adhesion of the cell. So it can happen between two normal cells or a pathogen and a normal cell. So there will be two cells adhering, and because of defective adhesion, if normal adhesion, now look at this, if normal adhesion had happened, there will be two cells like this with cadenins like this. Now, because of defective adhesion, what is happening is one cell is becoming like this, and ultimately internalization of the other cell is happening. And entosis, classical example where it happens. It happens in Listeria monocytogenes. Pathogen Listeria enters into the cells by using this phenomena of entosis. So expect this in the next exam about entosis, Listeria monocytogenes. So what is happening in Listeria is Listeria will go and attach to the membrane of the cell, and it will be internalized by entosis. Okay, entosis. So this is one of the mechanisms, just like your phagocytosis and pinocytosis, entosis. Emperipolesis is also sometimes cell-in-cell appearance, but basically it will be a histiocyte, which or any of the hematopoietic cell would have engulfed other cells. This is seen classically in Rosai-Dorfman disease. Rosai-Dorfman disease. Emperipolesis. Next. So next question, so even emperipolesis also partly correct, cell-in-cell appearance only it will be. Next, neurosecretory bodies are seen in all except. So where don't you see neurosecretory bodies? So neurosecretory bodies, if you remember, or neurosecretory granules are seen in neuroendocrine tumors. So which are your neuroendocrine tumors? We discussed this. Carcinoids are neuroendocrine tumors. Then paragangliomas and pheochromocytoma is also your neuroendocrine tumor. Apart from that, medullary carcinoma of thyroid, yes, it is a neuroendocrine tumor. Adrenocortical tumor or adenoma is not. Adrenal medullary tumor, that is pheochromocytoma, is a neuroendocrine tumor. So not seen in, except this will be the answer to this question. And in all other three it is in. Pituitary adenoma also you can be seeing neurosecretory granules, right? So I think there was identify the cell. So they had given an image of mast cell, I think. So there was an image, and image, the cell was somewhat like this but had lots of blue granules like this. So one which are having granules are your either basophils or the tissue derived mast cell, and they had given a history of toluidine positive. So answer is mast cell in that. I have not included the image because I don't know whether image was given exactly or not, but it is not plasma cell. Do not confuse. Plasma cell will not have granules. I think somebody told me answer one of the option was plasma cell. Plasma cell is not the answer because it will be agranular. There are granules present, so it will be not macrophage, not lymphocyte, not plasma cell. Answer will be straight away mast cell only. Now, which of the following is a marker of NK cell? This was one bouncer question. Many of you were expecting 1656 because we commonly use these markers for diagnostic purpose. Those are not given. We knew CD3 is not there. We knew this. And CD68 is a histiocytic marker. And if you did not know, I would have said you would have better left this question and come, because it is not this, not this. Answer is CD94 in this. And CD94 actually is not used as a marker to define NK cell. CD94 actually is an inhibitory molecule. Inhibitory molecule for NK cell. It is also expressed in some of the T cells as well. It inhibits the release of the cytotoxins. And this is very important, especially in NK cells, because NK cells are not MHC restricted. So basically CD94 gets excited every time your self-antigen is present in a cell. So that is what is the role of CD94. And it is more functional use rather than diagnostic purpose. We don't use it for a diagnosis of NK cell. It's just a fact-oriented question. And this was more like an obstetrics question, but anyway. So these were like I would leave it and come back rather than just attempting giving a guess there. Which of the following are increased except? So it is fact oriented. Answer is option D in this. Factor 11, factor 13 also decrease in pregnancy. Basically all other coagulation factors are positive acute phase reactants. They increase in pregnancy. So I do not know if the examiner was asking about that there. This question 19, question number 19, we had discussed this twice, I think, in one in class test and also the systemic class test, and also I had given one of such question in your grand test as well. 15-year-old boy presents with a diaphyseal lesion. There also I had given history of diaphyseal. Histology is as shown in the image, which were positive for MIC2 was given in the question. I think I had given CD99, same thing actually, and they are positive for synaptophysin. Yes. So what is your likely diagnosis? So options are in this options small cell. It is not small cell osteosarcoma. Answer is now MIC2 positive. Definitely we have made a diagnosis of Ewing sarcoma. It is not metastatic neuroblastoma. Many people would have confused. These are Omer-right rosettes, can be seen in Ewing's peanut as well, right? So this is a Ewing's peanut, primitive neuroectodermal tumor. Now this question I am not very clear about what was the exact history. You will understand what exactly was the question asked. Based on that, there are two options I can give, but I will end up giving you correct answer. Let us see. What was there? 72-year-old. First is I am worried about what was the age given. Some people said younger, for 50 years. Some people said 70 years. Presence of female presents with swelling of knee joint. So some said hip, some said knee. Not much difference. What definitely all history what I have got is large joint involvement. This I have got to know. There is reduced joint mobility and joint space. This I have got to know. So that means there is a joint involvement. Synovial biopsy was done and is as shown in the image. So basically examiner has given you, or the physician has done, or orthopedician has done a synovial biopsy. What is the likely diagnosis? So basically let us look at what are the options: osteoarthritis, rheumatoid arthritis, tuberculosis, Lyme's arthritis. Now in this, rheumatoid looks less at the age of 72 years and also single large joint involvement. Rheumatoid typically involves the small joints rather than large joints, and also will be symmetrical involvement rather than only one joint, which has been mentioned to us. And in rheumatoid, we don't take a biopsy to diagnose it. Rheumatoid is more of a clinical diagnosis rather than a biopsy diagnosis. And also 72 year, no, I would have expected somewhere around 30s, 40s, 50s rheumatoid. Maybe 50s also is fine, but 72 is too old for that. Next is, okay, so I can still keep, but okay. Now what about tuberculosis? Can happen because single joint involvement is there, only one joint was involved. Can be TB, but there were no granulomas, no giant cells in the image, so I rule out TB. Now what I got to know was some papillary structures as shown in the image here. So such papillary structure, these are hyperplasia of the synovial cells, actually will lead to such papillary structures, and you are seeing there is neovascularization inside. This was also seen, I guess, and there will be dense lymphocytic infiltrate. Pannus formation we call this, and this pannus can be seen in rheumatoid arthritis and Lyme's arthritis. Lyme's is by tick-borne disease, infection by Borrelia burgdorferi, right? So which is an infectious condition. See, very important, single joint is involved, start suspecting more of infectious rather than the systemic diseases like rheumatoid. Anyway, osteoarthritis is ruled out here because biopsy in osteoarthritis you just see bone formation, more of reactive bone formation in the cartilage. So that is not the case here. So that is not. So tuberculosis is also ruled out because no granulomas are seen. So now I would keep diagnosis query rheumatoid, query Lyme's arthritis to differentiate more in favor. I am more in favor of Lyme's disease or Lyme's arthritis here because a single joint is there, large joint is also involved, and biopsy was done. Very, very important actually when rheumatoid, because see, rheumatoid and Lyme's look very, very similar. Only difference is clinical differences that we have to look at. And usually for rheumatoid, as I said, we do not do biopsy there. So, but what was if you change me the history, then I can even shift it to rheumatoid as well. But with the given history, I will make it as Lyme. Next, which of the following is not AIDS defining cancer? Question says which is not AIDS defining cancer. So there are only 3 AIDS defining cancer: B-cell non-Hodgkin lymphoma, high grade especially, invasive cervical carcinoma, and Kaposi sarcoma. So these are your only 3 AIDS defining cancer. All other cancer can be associated with AIDS but not defining. So answer to this question, melanoma. Melanoma is not a AIDS defining malignancy. It's a repeat question actually. Earlier, very long back, it was asked AIDS defining cancer. I think it was discussed to you in some other medicine or yes. So let us look at this one. This also partial history, but anyway, enough history is there for me to make a diagnosis. A boy presents with multiple petechiae, atopic dermatitis. Blood examination shows small platelets, low platelet count. I think some 15 or 20,000 was given, whatever was given, low platelet count. Normal WBC was there. Next best investigation. So they had asked what is the next investigation or next best investigation, I do not know, but anyway both will remain same here with the options. Okay, so VASP gene mutation, this will be seen in Wiskott-Aldrich syndrome. Antibodies to platelets will be seen in ITP, and bone marrow examination will be the next investigation in aplastic or leukemias, and EM of platelet, electron microscopy of platelet. So now look, very important, I rule out option D straight away because I am not suspecting a ITP here. So I am ruling out that. Bone marrow examination is also ruled out because the WBC count is normal. Neither I am suspecting leukemia nor I am suspecting aplastic anemia in this. Right? So that is also ruled out because thrombocytopenia can be associated with aplastic anemia or leukemia in a child, but none of them look. So now Option A, option D, EM cannot be the next investigation because, and anyway, we don't do much. There are hardly any diseases where we do EM for platelets. So VASP mutation, if you remember, Wiskott-Aldrich syndrome presents with a triad. What is a triad? Triad was eczema. So that is what is given here. Atopic dermatitis, allergy, allergic eczema will be there. Then there is thrombocytopenia and there will be recurrent infection. So examiner has not given you recurrent infection, rest 2 has been given to you here. That is why answer is VASP gene mutation. You will do that investigation. Now, one more question. This was your, okay, not true about clear cell RCC, clear cell carcinoma, clear cell renal cell carcinoma, basically clear cell renal cell carcinoma. So RCC, multiple true false were there. Occurs due to long arm of chromosome 3 deletion. Basically they are telling you, or 3q deletion, whatever they had given in the exam. So this is a false statement. It occurs not due to 3q, it occurs due to 3p deletion. That is true. 3p deletion is true. VHL is 3p, not 3q. Mostly sporadic. This is a true statement. Arises from DCT is a false statement. It arises from proximal convoluted tubule. DCT, papillary RCC arises. Contains glycogen and lipids is a true statement. So question says not true or false statement. Option A and C are false here. Option A and C are false. Next, question 24. Which of the following is not screened in blood transfusion? So question says which is not screened. Straight away everybody knew this. Dengue, we discussed this. 5 tests we do: HIV, HBV, HCV, malaria, syphilis, right? Yes. So answer is dengue. We don't screen for dengue. We don't screen for dengue. Next is okay. This little bit I want to know anyway. Doesn't matter much with the history. Any other history, if it was missing, then I don't know. 60-year female, age I am not very clear. Some people said 50, I guess. Okay, presents with easy fatigue and pallor was there. Okay, and blood examination, hemoglobin 6 gram per deciliter. So which of the following is expected? And I hope there is no other history given in this. So female with easy fatigue, most common diagnosis will be IDA. And if it was 50, around 50, 60, early age, around perimenopausal woman, DUB would be the cause. Postmenopausal 65, 7, 60, more than 60, I would think of colorectal carcinoma also. In males or females, doesn't matter. So I am making a diagnosis of IDA, and hemoglobin is 6. I am making a diagnosis of severe IDA. So what investigation should be done? What is expected in this patient? Microcytic hypochromic RBC, yes, that is true. I am expecting that. Poikilocytosis also I am expecting. Sir, what about target cell? Target cell classically are seen in thalassemia, and sickle cell can be seen in severe IDA. There I had mentioned it when we were discussing the mechanism of target cell. This is a severe IDA. So this also is true. If it was multiple choice, I would answer these 3. Macrocytosis is not. So in this, 3 of them are correct in the given options for me. So I do not know if there was any other option also. Multiple true, answer A, B, C are true in this. Next, 26. I don't know, did they ask you the diagnosis or did they ask you to diagnose what is it, or both of them? Because I got 2 different from different people here. So there was an image given like this, somewhat like this, and yes. So what is this? This is your Schiller dual body. Schiller dual body. This we had discussed in our female genital tract system. Schiller dual body. Central blood vessel will be there. So there will be a central blood vessel surrounded by some space. Then there will be cells around this. Again surrounded by space. Again, then there will be one more set of cells here like this. So this is your Schiller dual body. Blood vessel, then space, then cells, then space. This is Schiller dual body seen in yolk sac tumor or endodermal sinus tumor. So this is the correct answer. Endodermal sinus tumor is the correct answer. Next, question 27. This question only one student has sent this to me. So I don't know whether do you recollect exactly, but student was very confident that this is exactly what I recollected. Okay, let us see what is that. In iron excess condition, protein A is secreted by liver, which causes down regulation of protein B. So it was very hypothetical in nature. So basically something secreted by liver, A is secreted by liver in iron excess. This down regulates B in the gut. That is what has been given. What are A and B? Of course, iron excess state, liver is hepcidin secreted by liver, and down regulation of ferroportin it should be. So B will be ferroportin. So option C is the correct answer. So please tell me, was the correct recall or not? Next question, one more was, which of the following is false about anemia of chronic disease? Straightforward question was there, and we have discussed this a number of times. Low serum ferritin. Serum ferritin is high in anemia of chronic disease. It can occur due to chronic infection, but it need not be a must. Increased hepcidin, okay, yes. Adequate iron stores, yes, patients will be having adequate iron stores there. Next, okay, one more question. This one I have kept it, I want you to please send it to me in my inbox on Telegram. You can search on Telegram. You can just directly do an inbox at the rate Sanjeev Chitragar. You can just do this, and if you have any more questions also you can. So they had given lung mass synaptophysin positive. If this was the case, then the diagnosis will be small cell carcinoma. Small cell carcinoma is also neuroendocrine in origin. So it will also be having synaptophysin positivity, chromogranin synaptophysin positivity. And one more question, question 30, I don't remember. There was a question asked on human genomic project. That is what I learned. Yes, was there a question on human genomic project? What was the question? Because I have not got any options regarding this. So please get me back with these questions on my Telegram, so that I will include in the PDF which I am going to circulate it to you subsequently. Okay, so this time there were lots of questions. I will tell you which all you should have definitely answered. I am sure 29th, yes, this I should have got correct. 28th also I should have got correct. 27th I should have got correct. This also I should have got correct. So I am talking about this one. So 26, 27, 28, then I'm 25 also. I am sure I would have got correct. 24 correct. Yeah, all these are easy ones. Even this was also easy one. This possibly doubtful, but if you had solved DQB and other tests, you would have got this. Then this I did not expect you to get anything correct in this. So leave this, don't worry. So I would not expect you to get it correct, because still there is a lot of recollection problem in this. I would not expect this to be. Ewing's peanut, you should have got it correct. This definitely not. I'm not expecting you to. So I'm not expecting 2 out of them. 2 out of 30. NK cells, again query, I would say plus minus, because at least you would have ruled out CD3 in this. CD68 is a histiocytic marker, that also you could have ruled out, but 25 was difficult for you. So 3 of them. Then this, yes, you should have got it correct. This also. So only 3 out of correct. 4, this also by ruling out. So I am expecting out of 30 you have got 27 or 3 not expected. This also I am expecting you to get correct. This of course yes. This we have discussed it. This we have discussed. This, if there were 2 close options, then difficult, but still plus minus I would say. So 3 plus minus, 3 not expected to answer, 2 plus minus. This question again plus minus. Cry-do chat I would have expected. This also I would have expected. This also I would have expected. Fish also I would have expected. Yeah, I didn't expect this to be answered by you. So I'm not expecting you to answer 4 to 5 questions, and I'm sure not you, most of you will be getting these 4 to 5 questions wrong. So you need not worry about it. I keep telling this again and again. In AIIMS, intentionally they give few questions at a PG level, so that they want to see how many questions you want to leave as well sometimes. Only thing is, this time number of questions were very huge, especially from genetics. So if there is any mistake in my recollection, please tag me on Facebook in the club, or you can send me a private message on Telegram as well. Thank you.